Okay, now for the elephant in the middle of the room. I think that's the right expression. No matter your opinion, we all need to know about healthcare reform and any changes in legislation, because a lot of changes in legislations are going to affect you, the consumer. Joining me now is Jim Smallwood of Moody Insurance, and I want to give a caveat. Some of this information is going to change because we know how the political scenario is going to unfold. Or we don't know how the political scenario is going to unfold. But this is the information we have at this moment. So welcome, Jim.
Great, thank you.
It's so good to have you here. Now, I've asked you to do a big thing to tell us what happened, what's going to happen, and what's going to happen in the big year, which I think is 2014?
That's correct.
Okay, good. So where are we now?
Well, I think we should look at a lot of the good things that have happened.
Okay, so you're a positive person. Good.
Well,
Good.
You hear a lot about the negative things,
Right.
for sure, and I don't think the bill was drafted really as the dream legislation for anybody.
Right. I don't think any legislation is ever dream legislation, you know?
Yeah.
Truthfully. Okay.
Sure. But there have been some really good things that have come out of it
Okay.
that I think the consumer can really appreciate. Things like dependent children being covered up to age 26.
Right.
So young people can stay on their parents' plan longer.
Right. And in this economy, that's particularly important because a lot of people who are graduating from college or high school are not getting jobs right away.
Absolutely.
Right.
It's been huge.
So they're not getting in health insurance, so it's good that they get to be on their parents.
Exactly.
So
exactly.
I just went off my parents last year. So no, I'm just kidding. Okay, go ahead.
So did I.
Okay, yeah.
So that's been really good. The elimination of pre-existing condition limitations for children has also
Oh, is
been
it
good.
only for children?
For now, it's only till children.
For now, okay. But
Correct.
later on, it's going to be for adults as well?
Precisely.
Okay. Very
Great.
good.
So that's been very good. The elimination of lifetime maximums. So before, if you had something really expensive happen, if you spent, let's say, $1 million of the insurance company's money or $5 million, they would cut you off.
It caps. There's a
Correct.
cap. So if I had mastocytosis, a kind of blood cancer, or leukemia, I think it is, and the treatment was $20 million, but my policy had a cap of $1 million, that other $19 million, I'm on my own.
Correct.
See,
Yeah.
that's hard. I mean, so you get
That was
part
really
of your
tough.
part of your cancer gets treated. It kind of.
Yeah, or you go bankrupt.
Right, or you go bankrupt.
Yeah,
or,
it was very tough.
Yeah, okay, and so that's a good. Those are good things.
Absolutely.
So then,
Absolutely.
then what? What's the next step? A few changes coming up.
Yeah, things will be pretty quiet between now and 2014.
Okay.
There were some small changes. Yeah.
And we're going to elect a president, but stuff like that. But I
Yeah.
didn't say new president, by the way. I said we'll have the political.
For sure,
Elections,
the election, and that will probably impact things. But things will be pretty quiet. I think the consumer out there will notice the change in the flexible spending account
Okay.
more than anything else in 2013, or excuse me, 2012. There'll be a cap on that of $2,500, which people haven't seen today.
Right now, there's no cap on that.
Correct. It's up to the employer today.
Okay, and for those of us who might not know what a flexible spending account, isn't that where you put aside money pre-tax and put it like on a credit card, and you get to use that for specific health care?
That's exactly right. That's
Okay.
exactly right. A way to pay for these qualified expenses with tax advantage
Right.
dollars.
So if you know if you're going to have a number of prescriptions and a lot of office visits and things like that, you might want to put, say, $500 or $2,500 aside. But it's also a use it or lose it
Correct.
thing. Is it still use it or lose it? Will it still be use it or lose the money?
It is, with a couple caveats.
Of course.
but
I would
definitely.
ask a more complicated question. Okay, so before we wrap up, let's talk about 2014. What's happening then? What's the big?
Yeah, that's the big year.
Okay.
That's what's causing all the controversy. Is 2014 is the time that Americans, by law, have to have health insurance. They have
Every
to
American?
buy every American.
What do they do if they're unemployed and don't have money to buy insurance?
They will be able to go to an exchange, which I sort of look at like a giant website for health insurance that
Okay.
everybody can go to.
Okay.
Everybody gets accepted with no pre-existing condition limitations,
Okay.
and if you can't afford to pay for it, the government will subsidize it.
Wow.
So it's huge.
It is huge, and that's probably the controversial part, that the government is subsidizing it.
That, as well as if you don't purchase the insurance, you have to pay a penalty, which starts off quite small in the first year, but can grow to 2.5% of somebody's income if they choose not to buy insurance. That, and employers need to purchase insurance for their employees or potentially face a penalty themselves.
So it's perceived as a hardship on probably small businesses or employers.
Employers
Right.
for sure. It impacts businesses that are over 50 employees, so not the smallest businesses, but certainly businesses over 50 employees who don't consider themselves very large.
Okay.
Which, obviously, let's face it, it's a lot of us.
Right, exactly. All right. Jim Smallwood, thank you so much. That you did a really good job of wrapping up the next couple of years for us in terms of healthcare.
Thanks for having me.
My pleasure.